One recurrent problem in our healthcare system that patients go through is when the pharmacist tells them that your medication is not covered under your insurance. This could mean several things, such as the medication is not under their formulary, it requires a prior authorization, or it is very expensive. It is up to the patient to take an initiative to see what is going on. The best way to do so is to call your insurance. That number can be found on the back of your insurance card. Once you get a hold of an agent, and if they do tell you that the medication is not under the formulary, you can ask them what the alternative is. You can then tell the physician the other options that is under your formulary and see which medication is best for your treatment. Another reason a medication may not be covered is that it requires a prior authorization. This means that your physician needs to submit documentation explaining why the patient is in need of this medication by indicating what other options the patient has tried and failed. In addition, they should send chart notes and any other lab tests proving to the insurance that you are in need of this medication. In other words, the physicians are giving medical justification as to why this particular medicine benefits you the best. Afterwards, it is up to the insurance to determine whether they want to approve or deny the prior authorization. If it is approved, it is typically good for a year, and the doctor sends the prior auth approval to the pharmacy so they can dispense the medicine. Now, if it's denied, it can be appealed if you call your insurance, or you may have to do an alternative treatment based on what your clinician decides. Last but not least, medication can be extremely expensive and patients cannot afford it. If that's the case, you can ask your doctor if they can give you samples of the medicine so you can supplement this sample until you are able to afford the medicine at the pharmacy. Samples are given to the doctors by pharmaceutical drug representatives who educate the physicians on how well the drug is doing and to see if they're willing to prescribe it to the patient. Now, another good solution is to go to GoodRx website. They basically give you a coupon to give to the pharmacist to give a cheaper price of the medication. Worst case scenario, your doctor may not have samples and you may have to call your insurance to see what is on the formulary. Overall, these are the steps I recommend you to take if the pharmacy tells you your medication is not covered by your insurance.